Hello everyone! In this video, I am going to talk about hydroxyzine. Hydroxyzine is a well-known medication with many brand names. Among them, it is popular under the brands Vistaril and Atarax. It is classified as an antihistamine. This medication can control the symptoms of anxiety and reduce tension in people. If you have excessive worry, irritability, stress, and negative emotions, you may be prescribed hydroxyzine to control these anxiety symptoms. However, it is not a benzodiazepine that is mainly intended for treating anxiety. It has few advantages over benzodiazepines in the short-term management of anxiety symptoms. Unlike benzodiazepines, it does not produce troublesome side effects such as muscle paralysis and impairment of memory. Consequently, hydroxyzine can be used to induce sedation and reduce nervousness without producing troublesome side effects. That's why it is used before surgery to induce relaxation and sedation. It can also be used after surgery. Apart from these clinical uses, it is also indicated to relieve pruritus associated with allergic conditions. It can reduce the itching on your skin that may be caused by hives and dermatitis. Besides that, it can also induce better sleep. So here in this video, I will explore such key facts as how to take this medication, how it works to reduce anxiety and allergies, and what the side effects are. We will also explore important precautions that should be considered while taking hydroxyzine. Now, let's see how to use this medication. Hydroxyzine comes in different dosage forms for ease of administration. It is available as tablets and capsules. Each tablet contains hydroxyzine as its hydrochloride salt. They are also available in different strengths. It comes in 10 mg, 25 mg, and 50 mg tablets. Therefore, before taking, ensure that you are using the right strength intended for you. It is also available as an oral solution. Hydroxyzine exists as a different salt in a few capsules and syrups. They contain it as hydroxyzine pamoate. However, it is equivalent to hydroxyzine hydrochloride salt. Capsules are available in two strengths, such as 25 mg and 50 mg. Syrup contains 25 mg of hydroxyzine hydrochloride per 5 ml. The dose of hydroxyzine depends on its purpose of use, its response, and your age. Your doctor will suggest the right dose based on these factors. If you are using hydroxyzine for treating anxiety, you may be given a dose of 50 to 100 mg up to 4 times a day as needed. However, dose is individualized and may be lowered in people with any cardiac risk. In children aged 6 to 12 years, it is given at a low dose ranging from 50 to 100 mg per day. Children below 6 years, dose is restricted to 50 mg per day. For treating anxiety, hydroxyzine can be used for up to 4 months. Over this period, your doctor should assess the benefit of its continuation. To treat allergies, hydroxyzine is still given at lower doses. If you have pruritic conditions and itching, then hydroxyzine is given at a dose of 25 mg, 3 to 4 times a day. You can take this medication either before or after food. Hydroxyzine is rapidly absorbed into the body, and it starts showing its effects immediately, within 15 to 30 minutes after you take this medication. Now let's look at how hydroxyzine works to reduce anxiety. Hydroxyzine reduces the action of a small chemical in your body, histamine. Histamine has several roles in our body. It can increase the allergic response, leading to skin rashes and itching. It causes dilation of your blood vessels. That's why you can see redness and warmth on your skin during an allergy. The action of histamine in the brain is more complex. It plays an important role in arousal and memory. Stress and emotions are often associated with elevated levels of histamine in your brain. Histamine also increases gastric acid secretion in your stomach. However, all these actions of histamine are not mediated through the same types of receptors. Hydroxyzine acts on histamine receptor type 1 in your brain. These H1 receptors are excitatory in nature. In people with stress, these receptors are excessively activated. Consequently, the phospholipase C enzyme is activated. It releases two mediators from phosphatidylinositol biphosphate. One is inositol triphosphate, IP3, which releases calcium from the sarcoplasmic reticulum. Another one is diacylglycerol, DAG, which activates protein kinase C. All these actions result in increased levels of calcium in the cell, leading to excitation. This results in the development of anxiety, tension, and worry. Hydroxyzine blocks these H1 receptors, thereby controlling the symptoms of anxiety. It can also induce sedation and sleep. Similarly, it blocks the action of histamine on immune cells and blood vessels. This results in a reduced allergic response, controlling itching, swelling, and redness of the skin. It also shows a little antiemetic activity. However, it doesn't reduce gastric acid secretion as it is controlled by histamine type 2 receptors. Now, let's discuss what the side effects of hydroxyzine are. Hydroxyzine is well tolerated and shows mild side effects. Many of the side effects shown by hydroxyzine are commonly observed with antihistamines. Among these, sedation and drowsiness are the main side effects you can observe. Apart from this, you can have few side effects that are mild. You may have blurred vision, a dry mouth, and constipation. Hydroxyzine can affect the transmission of a chemical mediator called acetylcholine. Due to the blocking of cholinergic receptors, it can cause these kinds of side effects. Normally, the dry mouth produced by hydroxyzine is well tolerated. However, it may be enhanced by other medications taken simultaneously. If you have more dryness in your mouth, try to choose sugar candy to relieve the dryness. Now, let's focus on the precautions that should be considered while taking hydroxyzine. Hydroxyzine can make you feel drowsy. It's common with many of the antihistamines used for treating allergy and cold. They can enhance the drowsiness and dizziness produced by hydroxyzine when combined with it. So it is better to check for any simultaneous use of central depressants and over-the-counter medicines that contain antihistamines. Alcohol can also increase your dizziness. So if you have significant drowsiness during the early days, it is better to limit your intake of alcohol. If you feel more drowsy, be careful while driving your car. For the elderly, hydroxyzine should be used at the lowest dose possible. They may have more effects of drowsiness, dizziness, and confusion. Your doctor will suggest the right dose, based on your age and renal function. Like many of the antihistamines in this class, hydroxyzine also shares its proarrhythmic effect on the heart. It can modify your heart rhythm, especially at higher doses. It can cause QT interval prolongation in the ECG. That's why you should never use more than the dose recommended to you. If you observe any pounding heartbeats, a feeling of fainting, or an irregular heart rhythm, then discuss them immediately with your doctor. Hydroxyzine should be carefully used by pregnant women. Especially in the first trimester of pregnancy, hydroxyzine can cause serious side effects. The benefits of its usage should outweigh the risks associated with its use. So, don't use this medication until your doctor suggests you do so. Finally, let's see the chemical form of this medication. Hydroxyzine is a piperazine derivative. It is structurally not related to benzodiazepines and phenothiazines. It has another group attached to piperazine. This is a methyl group with two phenyl rings. That's why hydroxyzine is also considered to belong to a class of diphenylmethanes. On the other side, it is attached to an ether chain. That's all about the pharmacology of hydroxyzine. Thanks for watching this video. Please don't forget to subscribe and hit the like button. Stay tuned for another interesting video with a new topic. Until then, have a nice time, take care, and goodbye.